All right, hello everybody. Dr. Singer here today to talk to you about a very common condition, one that I take care of very often in my office, called lower back pain, and specifically how to get your back pain taken care of. Now, first thing we're going to go over is the normal biomechanics of the spine and the back. So the first thing I want you to notice is this is somebody just standing straight up and down. What you want to know is that the spine is straight up and down. In other words, it's not curving to one side or the other. Out of that, we also know that there are the nervous system that comes out of there. So you have the brain sends the spinal cord down here, exits all the different spinal nerves. So we're gonna go over a little bit more about that and how different problems can occur and how that can create lower back pain. Know that normally you would see when the spinal nerves exit the nerve roots, you'll have different what's called dermatomal patterns or dermatomes, and each one of those nerves is responsible for innervating a different part of the skin and sensation for different parts of the body there, okay? When you look at also the nervous system, you'll see that it is broken down into two different categories. You have the parasympathetic response, which is cranial sacral, and then you have the sympathetic response, which is in the middle here. Those nerves are responsible for innervating different organs in the body, and obviously that's very important when it comes to just general health. So we'll talk about that. Here, just getting an idea of the intricacies of the different muscles that are attached to the spine. Noticing that there are muscles attached to the spine as well as going to different parts of the body. This is the lower back here, the lower lumbar, as well as the hips. Notice that there's things called bursa that are very intricately designed right underneath muscles in order to prevent too much friction of the muscles on top of the bones and allow the muscles to slide easier back and forth. Over here you could see what's called your piriformis muscle, where it attaches at the sacrum and attaches at the greater trochanter of the hip. I also want you to get an understanding of how intricately related both the musculature and the nerves are. In this case, the sciatic nerve is one that we're looking at here. That's the one that you've heard of, sciatica. So we'll talk about that and how misalignments in the spine and the hips can actually create problems both for the muscles and the nerves. Here we have a blown up picture of the lower back here, looking at it from a side view. These are the lumbar vertebra. Just wanted you to get an understanding of the discs that are in between those bones. They're there to provide a nice cushioning of the spine, making sure so when you're standing up you have pressure coming in from your body. You need to be able to absorb the pressure there, and that's one of the key functions of the discs. They're very strong material, but when there's misalignments, which we'll talk about later, that can create some problems for those discs as well as the nerves, okay? Again, I mentioned the bursa here and how they are there to provide a cushion in between the bones, or in between for the bones and the musculature and the ligaments. Over here in the bottom right, we have a picture of what's called your acetabulum or acetabulum. So what you'll see here is all it is a capsule that kind of holds your bones into the socket there. So you have a big socket on the side of your hip there. That hip bone actually goes right into it and fits like a cup and ball, okay? Here, also again, just going over all normal biomechanics. So normally, if you're looking at somebody from a side view, you have curves, okay? And the reason that we have those curves, let's say that we're looking at a side view of somebody looking at the neck here, this would be them looking this way, as you can see. The reason that you would have the curvature in there is, like, let's say that you were gonna jump from the table to the floor. You would bend your knees when you landed, right? And the reason that you would bend your knees is to be able to absorb the impact of the force of gravity and the force of the weight of the body. when we're looking at the spine here, you have the weight of the head, which on average is about 10 pounds. So you want to make sure that there's some absorption of the pressure or shock absorption that is happening in the neck. Now that follows into the mid-back, where you have a curve coming the other way, and then when you get into the lower back again, it comes into what's called a lordotic curvature, same thing that you have in the neck there, all designed to be able to act as a spring for the body and the forces of gravity. There can be problems that happen as postural imbalances start to occur, and we'll go over that later. All right, so what are some of the lower back problems or health problems that we're going to discuss today? Okay, so these are just general categories. Okay, one of them is muscle tears. You could have tears of muscles, including like the hip flexors, the psoas. Those are broken up into categories, grades 1 through 3. Number 1 is a very small tear, number 2 is a larger tear, and number 3 is a complete separation of the muscle from the bone. Okay, so muscle get kind of split in half. Labral tears, which we talked about what the labrum is what happens most commonly is it's an anterior tear, and so that when that happens, obviously that can cause pain in the hip joint itself, and we'll explain why that happens in a little bit. Bursitis, generally what it is just an inflammation of the bursa. We showed you those little bursa sacs. It's an inflammation of those. Now that can happen in one of two ways. There's both chronic bursitis, and then there's more of an acute bursitis. Acute bursitis happens when, let's say that you kind of get hit, like somebody, like in a football injury or something like that. Somebody comes and tackles them, and they hit that the bursa. It inflames. Lots of itis is generally means inflammation of, which is a bunch of blood rushing to that tissue. So in other words, somebody comes and hits them, the blood rushes to that area to repair the tissue there. Chronic, it can happen as well, where there is lack of blood flow to that tissue, and then it starts to inflame around it, trying to actually heal it. Okay. Osteoarthritis. Now, again, it's an interesting term when they say osteoarthritis, because arthritis generally means inflammation of, but osteoarthritis is actually non-inflammatory. It's more of a degenerative change that is caused by misalignments of both vertebra as well as other joints in the body, like the arms or the hips or going on. Sciatica and other spinal and peripheral nerve compressions. So this is where what I was kind of mentioning to you earlier, where there'll be a compression on a nerve. But let's just use the sciatic nerve. That can happen down in the lower back or coming out through the hip joint there, and we'll go over kind of some of the causes of that in a second. Herniated or bulging discs is where those discs actually bulge. We'll go over that more in detail. Internal organ referral. Okay, this is also really important for everybody to realize, is not all lower back problems are only from muscles and hip and ligaments and nerves, right? There can be internal organ problems, things like the kidneys, like so let's say you have a kidney stone or infection that would show up. I'll show you where all those different referrals happen. The prostate can represent pain in the lower back. Abdominal aortic aneurysms. I've had people that have shown up to my office with symptoms of lower back pain, and when we take some x-rays of them, we actually see that there's an abdominal aortic aneurysm there, and which is sometimes can be an emergency situation. So we refer those people out to be able to get them checked out and make sure that that condition is stable. Also, Gallbladder can show up as some lower back pain, more mid back pain though. Okay, we'll go over where those go again. Who's affected by back pain problems? Well, it's a lot of people. 80% of the population will experience low back pain at some point in their lives. Any age can be affected, of course. Any person of any age can have this problem, or any of those problems that I mentioned. It's the single leading cause of disability and missed work It says here 264 million days per year lost because of lower back pain problems. Costs America $100 billion per year in healthcare costs. That's from lost wages and missed days of work, which is obviously, that's a lot of money, $100 billion from this problem. When we go over some of the solutions, we could drastically reduce those costs in America if more people understand this information. That's why it's important for you to share it. Okay, increased 64, so the lower back pain has increased 64% from 2000 to 2007. So it went from 7.8 million cases to 12.8 million cases. So it's a big jump, and I think it's only rising at this point. I'm going to go over some of the causes of those lower back pain problems a little bit more in detail, but I want to give you just a general understanding of how I look at the body and how I look at health. When we look at the body, this is the body here. There's things that can create ease in the body or good health, and there's things that can create dis-ease in the body or sickness adaptation, okay? To create ease, you need what's called purity and sufficiency. Purity means you have none of the bad things that are supposed to be in your body. Examples would be the bad stuff, right? You know, not enough water, poor nutrition, excessive sitting, those kinds of things. And then when we go into sufficiency, has all of the things that it needs, right? All of the different things that the body actually needs. What creates disease? Toxicity and deficiency. In other words, the body is toxic with improper, thoughts, improper, movement, and then the last one is just like nutrition. Deficiency, in other words, they don't have the proper nutrition. So that's just a general idea of how I look at the body. We're going to go into, again, why back problems occur, specifically when we're talking about the stresses, traumas, toxins, and thoughts. When we talk about traumas, we're looking at physical stresses, toxins are chemical stresses, and thoughts are emotional stresses. Today, we're going to focus in on the traumas and the toxin component of it. Does not mean that the emotional component does not play into it. It's just not what we're going to talk about today on this talk here. Okay. If you want more information about thoughts and how that can create, you can create health in your body, go ahead and check out that video there. We have another video on our channel that talks specifically about. So take a look at that one. All right, so when we look at traumas specifically, we're going to go into number one, overweight. Okay, being overweight is a huge problem in America. Now, how does this affect the body? What happens is for every 1 pound of excess weight, so let's say you have a BMI that's supposed to be normal, for every pound that is excessive of just an average normal BMI, what happens is it puts 4 pounds of pressure on the joints of the weight-bearing joints, including both the spine, the hips, the knees, the feet, and it also can lead towards postural imbalances, right? So imagine, you have a large gut. What ends up happening is it puts pressure into your lower back, throwing that air out of sync, and that can also just kind of lead you towards kind of leaning forward more to be able to absorb some of that impact. Blunt force, which I discussed earlier, right? What that does is it can lead towards a misalignment of the vertebra or some of the joints. And what happens is when those bones misalign, they can start to degenerate. And I'm going to show you an example or a picture of that process that happens. Physical inactivity and movement deficiency. This is also a very large problem in America, and I'm assuming the world, right? Sitting in particular, which generally speaking, people spend 6 to 8 hours a day sitting down at desk jobs, things like that, cars, long commutes, those kind of deals. And it puts an additional 40 to 90% pressure onto your lower back, which is a lot of pressure going into the lower back there. 40 to 90% more pressure. Misalignments of the spine. Okay, some of these things can actually create misalignments of the spine. Now, again, when we're looking at health, we have to understand that health is holistic, right? None of these things exist inside of a bubble, so you understand that some of these problems can lead towards other ones, all right? So we just gotta understand that. Now, misalignments of the spine, let's say a subluxation of the neck, can create anterior head carriage. This is a global subluxation, which I have a picture of and I'll show you in a second. Puts pressure on all back muscles as well as the mid and lower back vertebra. So in other words, neck problems is not just a neck problem. It can create problems in your mid back and to your lower back. And I'm going to show you a picture of that. When that happens, you get a lack of nerve and blood flow into muscles of the lower back as well as into the hips. That could lead towards femoral acetabular impingement. So in other words, you're not getting proper blood flow, you're not getting proper nerve flow into those lower back and the hip area there. That could lead towards misalignments of the hip, causing impingement on those on the lower back there, or on the actual femur there. Pinching of lower back muscles leading towards sciatic pain, improper blood flow leading to bursitis and tears, which we'll talk about more too. All right, here's a couple examples of, also just improper seating positions, right? Let's say that, for in general, men, right, will be sitting on a wallet and their lower back. What happens is it creates a large imbalance or misalignment in the lower back, creating a lot of pressure, leading towards nerve impingement, disc compression, etc. Improper sleep position can do that as well. Not do that, but they can create misalignments. Continuous one-sided movements, let's say like a tennis player, they're consistently using the same arm. They overdevelop certain musculature in their body, causing the bones to shift out of their normal alignment, and that would also cause pressure on the nerves, discs, etc. Okay. Toxins, again, we talked about traumas, now we're talking about toxins. Toxins, the general idea here is joints need nutrients in the blood supply to heal them, all right? So if you have a joint tissue, if that joint isn't getting the proper nutrients that it needs to rebuild, what ends up happening is it starts to degenerate. That's one of the causes of degeneration of the joint itself, okay? How can that happen? What's called the STAD diet, or the standard American diet, a diet that is deficient in nutrients and full of toxins. If you want to know more about that, check out any of the toxin videos or the nutrition videos that I put out, okay? Alcohol, that's a kind of a no-brainer, causes dehydration. Dehydration, if the joints aren't getting the proper hydration to them, what they can do is it will start to wear down over time. Excess sugar can create inflammation in the body, of course, in the joints and in the lower back. Foods with high trans fats and omega-6 fats, again, those are more inflammatory in nature, create more inflammation in the body. And we talked about dehydration, makes the blood more viscous and unable to penetrate the tissue that it needs. In other words, you can't get the water into your disc spaces, your joint capsules, etc. So you need the water. It's very important, okay? All right, so we talked about what happens, we talked about these misalignments. This is what they actually look like, okay? When you have a misalignment of a vertebra, so these are the vertebrae, let's just, for example, we use these in the lower back since we're talking about the lower back, but these aren't specified. But what happens is this condition called a subluxation or a misalignment of the vertebra, which puts pressure on the nerve, right? Here we have a normal nerve flowing out. This is compression on that nerve there. What happens also is it puts pressure on the discs. So that can cause, starting off with disc bulges, that can create a lot of different degenerative patterns as well, which we'll show you in a second here. When those nerves are compressed, I showed an example of some of those kind of nerve patterns here. You can get problems with sensation loss, you can get problems with pain, numbness, tingling, weakness, all different types of areas. Wherever those nerves are going to, or organ dysfunction, wherever those nerves are going to, it can create problems there, okay? So now I showed you the degenerative processes, right? I talked about the degenerative processes. Again, if the misalignment happens, it's gonna put pressure on the disc, up to 200 times more pressure. And over time, those discs can actually start to wear down and create, well, these are the categories of degeneration. The example I give for this is, let's say that you have a car tire and you misalign the car tire, and then you just keep driving on the tire. Over time, that tire will start to wear down because of the pressure on it. Put the tire back into its normal alignment, then it will last you a very long time. Same with the spine. If that bone's out of alignment, puts pressure on the disc, and over time those discs can start to wear down, and eventually it could actually fuse together. Now, I could take care of people even if the bones are fused, but I'd have to work around those areas, right? But our goal is, number one, when I talk to my patients, our goal is to, wherever you are, number one, get you feeling good and get you functioning well, right? That's what everybody wants to do. Beyond that, it's about stabilizing your spine, making sure that the degenerative process completely stops, and then working on you to get your spine as close to normal as you could possibly get it. That's the goal for us here, okay? Stop that degenerative process. Now, because we talked about that degeneration, this is a example of what can happen inside of the actual spinal cord itself when those degenerative processes continue, right? So what they do, this is just looking straight down the spinal cord there. You'll see that normally that you're supposed to have a nice canal that the spinal cord can go through. If there's degenerative processes that happen around it, you'll actually get these bone spurs that start to build up, and they could put pressure on the nerves as well as discs and things like that. Now, I was mentioning earlier the misalignments, okay? Misalignment, so normally, the spine is in a normal position, has a good curve, good disc spaces, the fronts of the bones are nice and smooth. When you have what's called a phase 1 misalignment, let's say you get in a car accident, your head goes flying forward and backwards, it straightens out the spine in a condition known as whiplash. What happens is it'll put pressure on the discs there. Again, if you want to know more about whiplash, you could take a look at our other video that we did on car accidents and whiplash. But you can get that pressure on those discs there, and then what happens is it puts it strains the muscles, creates shoulder tension, and for every, and this is further degeneration, and you can see the postural changes that can occur with different phases of degeneration. Now, what happens is if the bone or if the head is going forward, it's called global subluxation. So normally the head is around 10 to 12 pounds. This is using 12 pounds as an example. 2 inches forward, it makes the head about 32 pounds. And for 3 inches forward, makes the head about 42 pounds. For every inch of forward head posture, it can increase the weight of the head on the spine by additional 10 pounds, which obviously we don't want. So our job is to get your spine into a normal position, wherever it is, get it into a normal position to minimize the amount of pressure on the spine. Because you could see that can cause, obviously, not only neck pain, but I mentioned, because your head's going forward, because we're talking about lower back health, if your head's going forward, it's going to put pressure through what's called your posterior chain. In other words, all the muscles down the back of your spine, down your back. So that will put more pressure on it, causing those muscles to tense up and become more susceptible to injury, more susceptible to nerve compression, etc. Okay? Now, when we have misalignments in the spine, again, we could see pressure on the disc. Those discs can actually start to bulge, and when they do, they'll put pressure on the nerves which are exiting the nerve roots there, okay? And that's just one of the causes of sciatica there, is like a bulging disc. We talked about the muscles can become inflamed or stretched out. So let's say that this hip gets misaligned over here. What you'll see is that because that hip misaligns, it'll pull on the muscle that's attached to it, which will actually pinch that nerve that's coming out of that area. So as we start to work on people, when we're talking about solutions here, balancing out the hips, getting the pressure off of those muscles, allowing the nerves to flow freely through them is just one of the ways that we can take care of people who have sciatica, or pain down the leg or in the lower back, okay? Yes, over here we have different areas, different conditions of the disc that actually can happen, right? So right here we have a normal disc. Below that we have a degenerative disc, which we talked about. A bulging disc is where just some of the material is still inside of the disc, but it's bulging out. That's hence the name. Herniated disc happens when actually those contents of the disc actually start to come out and outside of the actual the annular rings of the disc. And thinning disc is very similar to a degenerated disc. Here we show muscle tears and also trigger points that can happen and how they can show up as pain in different parts of the body. This is just an example, right? You have a trigger point, some of the muscles here. You could see pain that's just kind of into the lower back. That's like a muscle problem. Again, a muscle problem is not just a muscle problem. We have to look at and consider the biomechanics of the body as a whole, okay? Right here, injured muscle fibers in the lower back, you have a tear of those muscles, okay? Obviously it can cause pain and wherever those referral patterns, that's where you're gonna feel it. Normal labrum again, labral tear here on this side. Obviously that would cause pain in the actual hip itself. Here, we talked about bursitis. This is just showing you an inflamed bursa. What happens is that obviously can be very painful for you. Osteoarthritis, if we got to look at the joint and see if it's still playable, or if it can be regenerated. Some forms of osteoarthritis are, again, we talked about complete fusion, but as long as we catch it before that, we can prevent this process. And this process is these bones actually starting to grow together due to misalignments, due to overweight, due to et cetera, okay? Over here on this side, you actually can just visualize it through an x-ray. You could actually see, if you're having that hip pain, you could see it has normal joint space. It's nice and open here. On this one here, you're seeing bone spur formation and joint space narrowing, which is the definition of hip osteoarthritis. I mentioned earlier, and again, we're going to talk about some solutions in a second. So I want you to make sure you stay tuned for those. They're important. Referred pain regions, right? So specifically, and that can happen all over the place, right? Down here, we're seeing the appendix. We have the ovaries if you're a female, the colon, again, the urinary bladder, the ureter, prostate should be in there as well, but it's not pictured here. But these are just some of the areas where these internal organs can actually refer to, okay? When we look, that's all we got to see there. Now, traditional medical approach, because I'm going to talk about how we take care of things in our office. There is a traditional medical approach. I'm going to talk about some, now I'll let you know, some people, generally speaking, they're drugs and surgery, they're the medical approach. That's what they have, right? Some people absolutely need those. Some people absolutely need surgeries, but my goal is to get it done in a way that is natural, and those surgeries and the drugs will always be there. So majority of the time I could take care of it without having to send somebody out for surgery. Every once in a while somebody will need to go get surgery or will need to go get drugs, but that's more the exception than the rule, okay? Now when we look at the drugs, what are the problems? Why do we not want them to do that, right? So for pain, they have cortisone shots and NSAIDs. They're 0% effective at actually addressing the root cause of the problem. So in other words, NSAIDs, cortisone shots, they never will fix the problem, okay? All they're doing is masking the symptoms. Of course, again, some people need that if they absolutely need to get by for the day and they need to work and stuff like that. But our job is to get people off of those things. Obviously, we can't take them off of them ourselves, but allow them to talk to their doctor to get off of those medications. What are the problems with those other than the fact that they don't actually address the cause of the problem? Well, they suppress proteoglycan synthesis. So that is what your cartilage, in other words, proteoglycans are what your cartilage is made out of, right? So in other words, if you're taking those things, you're actually leading towards the breakdown and further arthritis. So over time, you can actually create more problems by taking the NSAIDs, taking the cortisone shots, right? causes the problems, creates more problems in the body, which is counterproductive, okay? The other thing we have, like opioids, right? We have the opioid crisis. Again, just masking the symptoms leads to addiction. 150 people die every day from drug overdoses. This is a very big problem. 400,000 people died from 1999 to 2017. This is a very big, huge problem in America, particularly, and we want to be one of the solutions for this, okay? Now, surgeries, some of the problems with these. Hip replacement surgeries have 5 to 10% failure rate, which isn't terrible, but you know, obviously that's not very good. Within 10 years, up to 25% of them fail after 15 years. Need for revisions afterwards, possibility of infections. Metal on metal replacements can leach metal ions into the bloodstream. Blood clots can form, nerve damage is possible, all these things that we want to avoid if we can, okay? Again, if we can, which is a lot of time. Spinal fusion surgeries, failure rate is as high as 50%. Main reason is misdiagnosis. In other words, they go in, they think that, you know, one of the vertebra or like there's a disc bulge that's happening, and they completely immobilize those joints. They never took into account the fact that it could be the hips that are misaligned, or it could be something above it or below it that's causing the problem. So that's a big problem. 5 to 36% recurrent rate of back or leg pain 2 years after discectomies for disc herniations. These are all just different journals that we got these out of. 29.2% of patients had some or increased pain 12 months after surgical laminectomies for lumbar stenosis. 35% success rate in terms of perceived recovery 15 months after an instrumented fusion for treatment of FBSS, which is failed back surgery syndrome. Again, this is what we're trying to avoid. Again, some people absolutely need it, but the majority of the people that come into here, we're able to prevent them from having to go and do that. Now, simple solutions that we address or we take care of or we do in our office here, okay? Adjustments, that's the primary thing that I do in my office is the adjustment. We adjust the spine, we actually put the spine back into its normal position. We adjust the hips, we adjust the feet, the neck, making sure that the neck is in the proper position. Obviously, we're looking at the whole, your body as a whole. Tractions to allow for proper alignment of the spine, both the neck and the lower back. And feet to allow proper biomechanics and nerve flow, right? So in other words, if the whole body is in proper balance, the nerves are flowing, the muscles are working the way they're supposed to. Exercises to rebuild normal biomechanics and strengths. Proper ergonomics. We talked to people about how to actually sit down. We're going to go over some of those today. Sleep positions, obviously important. We're going to go over that as well. Stress reduction for the emotional components, making sure you're getting plenty of sleep, right? Because if you're trying to rebuild tissue in the labrum, trying to rebuild muscle tissue, etc., you actually need your sleep, because 80% of the sleep 80% of the healing that happens in your body happens when you're sleeping. If you're having trouble sleeping, I have another video on actual sleep health or insomnia, so you can go over that one. And obviously, as you're getting less pain in your body, you'll be able to sleep better. That is across the board. I hear that from all my patients. Maintain a healthy weight. Obvious reasons we mentioned earlier. Dietary supplements, essential oil, we'll go over some of those. Detoxification protocols. Why do we do detoxification? So that the blood has the proper nutrients, it doesn't have the toxins in it. All right. These are just examples, okay, of corrections, what I was mentioning to you, right? So if somebody has a straightened out spine, work on them, get the curvature back. From an anterior to posterior view, you're seeing, tilting of the head, misalignment of the actual vertebra there. We're working on actually straightening them out. In the lower back, if you have a straightening of the lumbar lordosis, where there's supposed to be a curve, work on it to get the curvatures back. And the same things in the lower back here, where we have a curvature or a scoliosis. Proper adjustments, traction devices to help to rebuild the actual curvature there, or get that spine straightened out. This is some of the examples of different adjustments. This is me giving adjustments. Now, This is some of the mechanisms that we can use to actually help to rebuild proper curvatures or functional alignment. Now we're looking at a lower back here. This is somebody with, again, a straightened out lower back or a loss of lordosis. This is called a deneral. It's a block that you would go on to actually increase the amount of curvature that you have in your lower back. Here we have the discs, right? So compression on the disc or a herniation. This is called decompression. This is what we do in our office. It's called flexion distraction. The idea is what you're doing is you're creating what's called a negative pressure on the inside of the disc space right here. So a reduction, creating a negative pressure, allowing the contents of the material to actually start to go back into where it's supposed to be, okay? As opposed to being compressed out and actually pinching off the nerves which are going into those areas. So that's one of the things that we do particularly, and it's very, very effective at helping people with lower back pain. This would be contraindicated if somebody had like a muscle tear in their lower back, but that's something that we would screen for before that. This right here is it's a different type of traction device called a posture pump. You could use it for the neck, obviously to help to rebuild the curvature there, but also into the lower back, right? Making sure that the lower back has the proper lordosis in it, which I mentioned earlier. Okay. Some exercises that I recommend in my office to help people just get general posture and back health. One of them is called neck extensions, right? So this is just a simple strap, a cushioned strap that we put on. You put it behind your neck and you pull down. Helps to help to increase the curvature in the lordosis, helps to bring the head back into a proper position, taking pressure off the lower back. T's, Y's, M's. So these are simple exercises you do. And let me demonstrate this one too, just like that. The T's, Y's, M's, you're standing, this, that, and this, and you hold that for about 30 seconds to a minute, a couple times a day, and that will help to obviously get that neck over into a proper position, which takes pressure off the lower back as well. Lower back exercises, right? Cobra, again, if we're trying to increase, if the problem is you have a decreased lordosis in your lower back, this is called the Cobra Extension exercise. You lift up to where your hips don't lift off the ground, and what you're doing is increasing the the curvature in the lower back, as well as creating a negative pressure in the disc space to actually draw those materials back into as well. This is somebody doing a inversion table, right? So inversion table, same idea, same concept. You're opening up the disc spaces in the spine, particularly the lower back for this instance. Foam rolling, which I'll show you in a second. Stretching type muscles, I'll show you those as well. And then for labral tears, hip tears, or an osteoarthritis of the actual hip itself, what we do is we give people weighted exercises, right? Have them standing up with their leg not touching the ground, put a leg weight on their leg, and literally just very simply, kind of very gently back and forth, moving back and forth. I'm going to be putting up exercise videos very shortly here, so stay tuned for those. Here is different foam rolling exercises that you can do that are very, very helpful for lower back pain. This one works the hamstrings, you can work the quads, and pretty much what you're doing is you're breaking up trigger points and adhesions in the musculature, which can cause pain, obviously can compress nerves, things like that. These are the quads. This is the IT band or iliotibial band. Very important to get that one. It's very tight on a lot of like athletes or people that sit down for a long period of time, which is the general population, right? Glute muscles, calf muscles. There's a lot of different ways that you could do these exercises here. Foam rollers are great. Lower back stretches, child's pose is wonderful, right? You're stretching out the lower back here. Puppy pose, I don't do that one too often. Cat calf, fantastic for just general lower back and mid back, and just full spinal flexion and extension. So you're kind of going back and forth. Again, look out for the videos that I'll be putting out for all of these different exercises. Head to toe, you're bending forward, stretching out the hamstring, stretching out the lower back as well. Folding forward, downward dog. Spinal twists are also very good for the lower back, increasing the pressure or increasing blood flow into the disc spaces themselves. General range of motion, rotation, it's really good for it. You'll constantly, every single day, you want to put your spine through full range of motion exercises. Plow, which is where you're stretching out that lower back, really good for it. This is one that is overlooked, understanding that the soleus muscle, or the muscle behind the leg, is a pump which actually pumps blood into the lower back. So if that muscle is too tight, this guy right here called the soleus, what ends up happening is every time you take a step, you're not getting enough flexion of the foot, or it's called dorsiflexion of it, and blood isn't actually returning into your lower back. So making sure that this muscle is stretched out properly so your foot can bend is very important. So just getting a block, putting your foot on it, bending the knee forward. Your goal is to try to get your knee over the top of your toe there. Core strengthening, very important, right? Because if you have what's called a weak core musculature, you can be prone towards misalignments of the spine, prone towards muscle tears, things like that. So the process of strengthening the core is as follows, right? So number one, you first have to learn how to breathe, okay? So simply laying down on your back, putting your hand on your stomach, taking a deep, expansive breath. Now what you should notice, as you breathe in, your stomach should rise first, okay? Most people, when I tell them to take a deep breath in, what happens is their chest goes, or their shoulders come up. Right? Now that is improper breathing, leads toward, it's called shallow breathing, okay? What ends up happening is you're not getting a full expansive breath, not getting full amounts of oxygen in your body, and can lead towards hypoxia over time. What you want to do is learn how to breathe properly, right? So you start by laying down on your back, put your hand on your stomach, take a deep breath in, your stomach expands, and then after that, your chest rises, okay? And then your chest compresses and your stomach deflates, okay? After you've learned and mastered just how to do that, your second goal is learn how to contract your core muscles, okay? Core muscles are rectus abdominis, your pelvic floor, and then the side transverse abdominis, the multifidi in the back here, as well as your diaphragm. This shows what's called your Kegel muscles, or your pelvic floor muscles. Pretty much the muscles that you use when you're going to the restroom, okay? So you would learn how to contract all of those muscles, doing the Kegels, contracting the core, and then take a breath in and out. So that's how the second thing you'd have to learn. Then you do that then you do that both at the same time, right? So, learn how to breathe, learn how to contract all your core muscles, then do both of those, that's step 3, at the same time. Step 4, learn how to do both at the same time while moving, okay? Some of the movements that you can do after you've gained the strength, and that process can take a while to learn how to do that. You can do things like tabletop, bridges, Pilates, front bridge. There's a lot of different exercises that you can do, and we'll have a whole video on this. This right here, how to actually sit down, office ergonomics, very important. If you're going to be spending 8 hours a day, you want to actually learn how to actually sit down while in a proper position, okay? Ideally, you want to find a way that you can do sitting and standing, get some type of raising desk, a desk that actually can go up and down with you. Here, you have the importance of having the knees bent at 90 degrees, arm bent at 90 degrees, something supporting your arms so you take the pressure off of and you're not bending your wrists, because that can compress the carpal tunnel. You want to make sure that you're not looking down at your screen, so you're making sure that the height of your screen is at a good point, so you're not looking down all day long. If you're standing, same principles, right? Get a soft mat to stand up on, so you're not on a really hard surface. Here, you can get different things to kind of help assist core muscle strength, right? So you can get a ball or a balance cushion. All these are designed to do, so this is something that you would put, it's kind of looks like a little whoopee cushion. You put it on your chair, you sit on top of it. What ends up happening is it provides a little instability of your lower back, which forces you to start to engage your core muscles. If you're going to start using these kind of chairs or balance cushions, you want to start with about 25 to 30 minutes and then work your way up slowly to about an hour at a time. You don't want to use it all day long because it actually is a pretty strong exercise for your lower back. So you want to work your way up with that. This is examples of poor posture, right? Examples of somebody in a slouched position, hunched forward position. This shows a lumbar support in a proper positioning. The position for your lumbar support should be where your elbow meets. So in other words, if you take your elbows to your sides, right there where your elbow meets the sides is where you should place your lumbar support. You could use just a rolled up towel if you'd like to. If you're driving, you could do the same thing. Very good for you, right? Standing up with a good posture. Go from there. You can get things can increase your movement while you work, so you're not completely stabilized, right? So you're not completely immobilized throughout the day. This is called a Cubie. Pretty much it's a little pedal that you actually can use during the day and you can use to exercise. If you're standing, you can get like a treadmill workstation, which is fantastic. You're exercising while you're working, and actually, it can. If you think about it, you're making it so your brain is active by moving. So very good. Makes it so you don't fall asleep. Proper lifting techniques, right? You want to make sure you're not doing things that are going to put tears in your muscle, right? So avoid bending from the waist only, bend at the hips and the knees. So this is an example of somebody going and picking up like a box on the floor. You locate your object, you bend at the knees to grab it, then you lift with the knees straight up, not turning your body, not jerking one side to the other, and then carrying it right in front of you, okay? Again, not to the sides, things like that. Hold heavy objects close to your body. Never carry or move anything which you cannot handle with ease. Move deliberately, right? These are important things. Proper sleeping position, okay? I get this question all the time, how should I be sleeping so that my back doesn't hurt me? Particularly if we're talking about the lower back, you'd want to get a pillow. If you're a side sleeper, you want to get a pillow between your legs. The reason for that is because you don't want your hip moving one way or the other, not collapsing, which rotates and put a lot of twist into your lower back as you're sleeping. Also, if you're side sleeping, you want to put a nice pillow underneath your head. The idea is you want to be as if you were just standing up straight, right? So if you're standing up this way, look at it from this angle. You want to make sure your pillow is not kinking your head up this way, not lifting it this way, or not too small where it's going this way. Just kind of a nice pillow underneath that supports you, that stabilizes your head. Sometimes contoured pillows work really well for this, but what I always tell people is there's really no one size fits all for it. You want to just I tell people, take a picture of yourself sleeping so that you can actually see, and ideally on your bed, so you can see how your position is while you're sleeping, and then you can get a good idea of if your head is kinked to one side or the other, if your lower back is improperly positioned, things like that. So just take a picture of it. Ideally, you would be what's called left side sleeper or the left side up. They've shown some studies that the stomach the stomach contents are in a better position if you're sleeping on that side with the left side up, as opposed to the right side up. However, if you're comfortable and you're not having any issues, you could obviously sleep on your right side, or if you have other issues that prevent you from sleeping left side up. Very good. Ideal sleep position on the right side. Very good. Okay. Stress reduction. We're not going to talk too much about these, but I want to give you just a general idea here. Gratitude, super good for you. Thoughts are congruent with if your thoughts and your actions are congruent with your values. In other words, you're not living a double life or living outside of your own standards. Meditation, guided or individual, is completely great. Has a lot of benefits for it. Affirmations, visualizations, journaling, diaphragmatic breathing. Again, I have a whole talk on this. You could look up that one. What to eat? Half your body weight in ounces of water every single day. This is not an eating talk. I'm not going too deep into it, but just generally speaking, good diets to look into: paleo diet, Mediterranean diet, ketogenic diet, although I don't advise a ketogenic diet like 365 days a year. You want to balance that out with days of with good carb days. Okay, so you want to balance that out. You don't want to do only ketogenic, because your body does need carbohydrates. Bone broth, collagen, helps to build and actually get the bones to be rebuilt. Anti-inflammatory diet, which we mentioned generally. High potassium foods, probiotic rich foods, apple cider vinegar, dark chocolate just because it's delicious, and juicing to cleanse the blood. Supplements that you can take: chondroitin, glucosamine, these are both, and hyaluronic acid. All three of these are specifically designed to help to rebuild cartilage and joint material. Turmeric, garlic, these are supplements that you could take that will decrease inflammation and increase immune system function. And then pure form omega oils, which is something that has healthy omega-3 fats and a number of other different types of fats that are beneficial for anti-inflammatory purposes. Essential oils, also very good, right? These are generally for pain control and anti-inflammation. Turmeric, copaiba, deep blue, which is a doTERRA product, birch, lemon, lime, peppermint, wintergreen. These are all very good. You could put them right on the joint with a carrier oil. So you'd want to use a carrier oil like a coconut oil to make it so it's not. And always test yourself first before applying it to a larger area, because you want to make sure you don't have any sensitivities to any of these supplements. Oh, not supplements. These oils. You can also include a few drops of neutral carrier oil, which I mentioned. Okay. Now, if anybody has any questions, feel free to reach. You can email the office, contact@singerchiropracticwellness.com. If we always offer a free initial consultation, so if anybody wants to come in, just talk to us here at the office. You're more than welcome to do that. We would love to hear from you. Okay. Talk to you soon.